CIT training came out of an incident in 1987 in Memphis, Tennessee, where a man with mental illness brandishing a knife was shot and killed by police. And this obviously resulted in community outrage. NAMI, various local mental health providers, and the Memphis Police Department joined forces to try to think of a new approach for officers to work with individuals who are experiencing mental illness. And really what it does is it combines the basic tenets of policing of community safety, public safety, and upholding the law with skills at interacting with individuals with mental health and or substance misuse disorders so that they don't result in unnecessary incarceration, but get instead funneled toward treatment. Part of that is also helping police officers identify those individuals in their interactions before the person gets arrested.
The greatest benefit of this program is to the people that we're serving because they're getting access to services in a manner that really meets their needs in a timely manner and avoids some of the potential negative consequences of being in a mental health crisis.
We really, as a police department, could not have asked for a better relationship between our agency and another agency in the city, particularly one that offers services to the very people that we're out trying to assist and that they're also out trying to assist. This team combines sort of the best of both of our programs and brings the best to the community.
The program really provides our law enforcement partners the opportunity to learn about mental illness and the various forms of mental illness, how to respond to somebody who's experiencing a mental health crisis, and how to involve mental health professionals in a co-response when somebody's having a hard time.
A big portion of the training involves verbal de-escalation skills. It also talks about some of the basic treatments in terms of behavioral interventions or medications that are used to treat these disorders. It also trains officers on mental health laws that impact their work. And our training in Manchester, we also include real role plays of scenarios that officers have encountered so that it can be truly realistic for the responding officers in the training.
I can genuinely say that the role playing is probably the most beneficial aspect of this training curriculum. During the role play, we really genuinely get to see the reactions of individuals that are experiencing mental illness in real time and how we can best show up to help them. Without that real life experience, it can be very difficult to help navigate those situations.
Certainly plays into adding a whole additional layer of empathy, understanding, patience, and really a different way of looking at things when we're dealing with someone that's in a crisis. As we understood more and more what the needs of the community were, we were able to narrow the program down and become more focused in our approach to helping them deal with those issues.
There is absolutely no way that this program would be successful without our partnership with the Community Mental Health Center. The fact that our officers get to meet and train with their extremely culturally competent clinicians and trained peers allows our officers to have an established relationship with this team, so that way we know what they need from us and they know what we need from them to be able to make sure that we're providing the support services that our community members need when they need it.
One of the great extensions of the CIT program has been that the Mental Health Center has embedded a law enforcement officer with our mobile crisis team 7 days a week on our second shift, which tends to be our busiest time for calls. That has allowed us to more effectively and safely and expediently respond to mental health crises. I think one of the other benefits for the CIT program is that our team members really also gain an understanding of what law enforcement has to prioritize in a situation in order for it to become safe to conduct a crisis evaluation.
We talk a lot about our officers and our employees being vulnerable and our strength coming from our vulnerability, just being genuine. We are people too, and to be able to collaborate with the team, to be able to help share our lived experiences with the people we're showing up to help, and being vulnerable ourselves will absolutely help the individuals get connected to the appropriate services. It's something that touches all of us, and I think that it's super important to be able to recognize those reactions and more importantly, know the tools that are available to help mitigate those stresses.
If there is someone out there struggling with mental illness and they're concerned, not even for themselves, but if it's someone that they know, make a phone call. The help is out there. At the end, if they're really not sure who to call, 911 is always an option. Call the Manchester Police. You can call the Manchester Mental Health Center directly, and you're going to get a response.